when you're going in to do range of motion on patients, typically you'll start with them positioned comfortably in the bed, and then you'll instruct them on, introduce yourself and then say, I'm here to do some range of motion with you. Ask about their pain, make sure they're not having any pain, and then I usually start with the shoulder, proximally towards the body, and you're going to want to support the wrist and then just behind the elbow so that they don't bend there, and you're going to start here flat and you're going to take it up and you go full range of motion if they have it available. If not, you go to the point where you feel them starting to resist you. Hold and then go down. You want to make sure you don't go rapidly. You want to take it nice and slow. And if you feel them trying to kind of do it and you're doing passive range of motion, you want to say, let me hold the weight of your arm. You just relax. I'm taking you through it. If you're doing active assist, you let them do a little bit of it, and then you help them on the points where they can't. If you're doing active, then you instruct them and you say, okay, Miss Patient, go ahead and raise your arm up, and I demonstrate how I want them to do it, and then have them do it. So now, can you raise your arm up as high as you can? Good, and now bring it down by your side. Good. Okay, so that's shoulder flexion and extension. The shoulder also can do ab and adduction, which is kind of like a jumping jack out to the side. So passively, you'll want to hold the same places by the elbow and at the wrist, and you're going to take them out to the side and up, and then bring it down. And then the shoulder can also do what we call horizontal ab and adduction, where you bring it across at shoulder height. So to do that, you're going to support the same locations at the wrist and the elbow. You're going to bring them out to about 90 degrees, and then you're going to bring it across and over, and then bring it out. And the shoulder, we also have internal and external rotation of the shoulder, which is this movement. So for that movement, you hold the same locations at the elbow and at the wrist. You bring them out to 90 degrees. I bend the elbow to 90 if they can, and then for internal, you rotate downward and then bring it back to neutral, and then for external, you rotate it upward like that. Now for the elbow, what you do is I always just let the bed support the shoulder, but you want to make sure they're not cheating. So sometimes I'll just kind of rest a hand here so that they're not getting any fidging or fudging at the shoulder. All right, I hold behind the elbow just to get it off the bed, and then I say, okay, bring your hand to your shoulder. And you just let them come in. You support the wrist and the hand so they don't flop. You just bring it up and then down, and make sure they get full extension at the elbow. Good. And then for forearm pronation and supination, I have them rotate up and then down, and I just kind of let them turn in my hand like that. And then for wrist, you get them in neutral, and I support right here, and I say flex down, bring it back to neutral, and then extend up. Good. And then at the wrist, they can also do what we call ulnar and radial deviation, which is kind of like you're waving. So to do that, I put them in neutral, and I say, okay, try to shift your pinky to the bed. Good. Now bring it back to neutral. Now try to raise your thumb to your shoulder. Good. Okay, now for the fingers, I support at the wrist, and then I use my hand here, and I use kind of my thumb behind between their MP and their PIP. I put my thumb there, and then I say, okay, go ahead and flex downward and bring it up. That way we're exercising what we call their MP joints. We're getting flexion at the MP and extension. And up. And you can do all fingers if need be, or if it's someone that has difficulty and you need to, you can take each finger. And then when I do each finger individually, I'll support at the MP joint and then bring it down. So sometimes I know we have patients where you have to take each finger individually and exercise the joint like that. And then to do the PIP, you shift your location of stability and you stabilize more distally, leaving this to move, and then you help support up here to move. Like that. And then to do the DIP, you just move on up the fingers, stabilize the PIP and the MCP and the wrist. You kind of have to use your whole hand to support them. And then bend down, up, down, up, like that. So, and then you can do each finger, or all fingers together, if you just stabilize across and then take them up. And then bring them down and up. And if you want to do all the fingers together for the all joints, the IP, the PIP, and the MCP, you bring them like that. And then you kind of come in and fold them back out. Cup them in and roll them down, and then come in and roll them back up. And the thumb over here, to exercise the MCP joint, it has several different motions that it can do. So we can do flexion and extension, and I usually just kind of stabilize at the base and bring it up and down, nice and slow. And then if you want to do the IP joint of the thumb, you just stabilize here, come up and down, up, down, up, down. And then the thumb also has opposition, so we want to go across. Like that. You also go in and out. Like that. And that's how you do range of motion for your upper extremity.